an emergency room in Montreal at over 200% capacity.
It's been overwhelming. A lot of the staff is feeling very tired. There's a lot of burnout, and people are feeling very stretched.
There are also 7 nurses short. It's been a bad summer in hospitals across Canada. Staffing shortages have meant extraordinary wait times, or sometimes losing services altogether. The emergency department in Perth, Ontario, closed for 3 weeks in July. It's since reopened, but
we have some more patients to see, less people to see them in, and things are on a pretty fragile tether right now.
Now, a call for new ideas.
Doing the same over and over again, throwing billions and billions of dollars at a solution and keeping the status quo is just not working.
The premiers of Ontario and the Maritime provinces convened in New Brunswick for a summit on healthcare. They all agree a new approach is needed, not ruling out private healthcare options.
Across this country, we have a healthcare system in crisis. So for me, all options are on the table.
Last week, Ontario announced a new healthcare strategy, including a plan to pay private clinics to tackle publicly funded surgeries.
I'm not suggesting that those couldn't be solutions. I'm saying we need to really think carefully whether we're actually going to get the biggest bang for our buck, or whether we're simply going to starve the public system in order to get better access for people in another setting.
But politicians and those in healthcare agree the staffing crisis must be addressed.
When nurses start to exit the profession from their regular employment, the system crumbles. And that's why you have ERs closing. That's why you have ICUs closing, because nurses are moving either to agencies or worse, even to the US, or leaving the profession altogether.
So, Paige, at this point, it's not unusual, unfortunately, to hear a lot about healthcare staffing problems, but what we don't hear a lot about often are the solutions.
Adrienne, so tomorrow the Federal Minister of Health and the President of the Treasury Board will be making what they say is an important announcement to show support for Canadian nurses. And over the last while, we've heard calls for everything from wage increases to mental health supports to making it easier for foreign-trained nurses to become accredited. So tomorrow, yes, we'll be watching to see what they have to say to deal with this pressing issue.
All right, Paige Parsons in Ottawa. Thanks, Paige.
You're welcome.